Meeting to order of the Health Commission Community and Public Health Committee meeting for Tuesday, October 18th, 2022.
All right, hi, my name is Mark Morwitz. I'm the Health Commission Secretary, and I will take the role. Commissioner Gerardo.
Here.
And Commissioner Chong.
Here.
All right, I will read the land acknowledgement. The San Francisco Health Commission acknowledges that we are on the unceded ancestral homeland of the Ramaytush Ohlone, who were the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land, and in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community and by affirming their sovereign rights as First Peoples. The second item on the agenda is the approval of the September 20th, 2022 meeting minutes.
I so move to approve.
Thank you. There's lots of folks on the line. I'm not sure if they're staff or community, so folks, just know that you can always press *3 at the beginning of an item to raise your hand to comment or ask a question. Know that questions are not answered by staff, but we can note them. And please press *3 now if you'd like to make comment on the minutes. All right, so since there's only two, thank you, there's no comments, no hands up. And since there's only two of you in the room, when one does a motion and second, that's an action. So we can move on to item 3, the Environmental Health Emergency Response Team. Update.
Yeah, good afternoon, Mark and health commissioners. My name is Patrick Fosdill. I'm the director of the Environmental Health Branch, and thank you so much for extending the invitation to the Environmental Health Branch to present this afternoon. When given these opportunities, I try to highlight a variety of programs. We have in our branch typically over 30 different programs. Today, it's my honor to highlight our Hazardous Material Emergency Response Team. I have with me Jonathan Piakis, who is the supervisor of that team and will be presenting in just a moment. The Hazmat Emergency Response Team are what I would consider the public health ninjas. These are very specially trained employees, and they respond on a 24-hour, 7-day-a-week basis. When the emergency phone goes off, it could be in the middle of the night with a call from the fire department battalion chief asking for help identifying an unknown material which spilled from a truck on a roadway, or it could be a call regarding an employee who has opened a letter with an unknown white powder and a threatening message on it, or it could be something like following a building being evacuated because there's a strange odor. So it's a whole variety of things that these employees respond to. Basically requires them to go from 0 to 100 miles per hour in just a few moments, and they need to be sharp and able to provide critical information and oversight of some situations that could be immediately threatening to life or health. So it's kind of a fun program, and I think you'll be interested in hearing what Jonathan has to present this afternoon. So without further ado, it's my pleasure to introduce Jonathan Piakis, who's a manager of our Hazardous Materials Program. He's also the supervisor of our Hazardous Material Emergency Response Team. So I'll turn it over to you, Jonathan.
Thank you, Patrick. Appreciate the kind words, and thank you, commissioners, for the opportunity to present before you today. It's not only something I'm a part of, but it's something I'm very passionate about. The Environmental Health Emergency Response Team is a very small team that a lot of people in the health department don't even know exists. So it's always, we relish the opportunity to let you know what we do in the shadows to make sure everyone's safe in the city and county. So let me share my screen here. Let's see, give me 1 second.
While you're doing that, just by the way, I've worked here for over 30 years and I'd never heard of this before, and I'm thrilled to hear about it. It's really wonderful, but it is something that's not well known. I think possibly the people who are involved certainly know, but I'm I'm glad you're giving it some a voice today.
Definitely, yes. It's a common thing we hear quite a bit. So it's always good to get the word out. So again, I'm Jonathan Piakis. I'm a senior industrial hygienist within the environmental health branch. I manage a number of different programs. One being the environmental health emergency response team. So real quick, this is what I would like to go over. I'm going to tell you how we came to be as the emergency response team, kind of the basics of the team, what we're trained in and our ongoing training, which is a big part of the job, how we're structured and some of our basic responsibilities, and then we'll go over some incidents just to give you a further look inside what we commonly respond to and some uncommon incidents as well. And then, of course, we'll have time for any questions or discussions as well. So in the 1980s, in June of 1980s, there was an incident on the Bay Bridge, which wasn't the main way that our team got formed, but it was certainly responsible for the push to form our team. So real quick in reviewing that incident, there was a truck that was going over the Bay Bridge with bags of white unknown material in the back of it. One of the large bags fell out and dispersed white powder all across the Bay Bridge. So not a good thing. Responders came out and were not able to identify what the material was, if it was hazardous or anything like that. So it did require that the bridge be shut down. In total, the bridge was shut down for 11 hours, which is a long time to have the Bay Bridge shut down and caused a number of issues. After the incident and they got everything cleaned up, they came up with a number of gaps that happened that basically caused the bridge to be shut down for that long, and identified a lot of those gaps that could be resolved and would have made for a much quicker, safer incident overall. So one of the main gaps that they saw was that they had a lack of personnel and trained personnel to respond to the incident, to identify what the material was and to clean up the material. They also had difficulties in obtaining the necessary equipment and supplies to identify exactly what the substance was, if it was hazardous, and if it was, how to best clean up that and ensure that everyone is safe and no one gets exposed to those things. The big thing was being unable to identify the substance. They eventually did days later. And it was only by sending it to a lab and having them run the sample on a number of different sophisticated types of equipment, it ended up being a non-hazardous substance. But not knowing that in the time, of course, we had to kind of err on the side of caution there and had to clean it up as a worst case scenario, assuming that it was a hazardous material that could impact human health. So with this incident and also a number of different incidents around the country where we saw some of our first responders getting injured, getting exposed to that, this led to the creation of the environmental health emergency response team, basically emergency responders within the health department that could respond with your more traditional emergency responders like police, fire, other law enforcement, to not only look out for their safety, but to also guide them on some of the more scientific aspects of the response to help them abate or adjudicate any of the issues. It's a more proactive rather than a reactive approach. Historically, there's been a reactive approach, especially when it comes to the fire department. We would have firefighters getting injured or getting exposed and then looking back on how we could have prevented that. Well, we don't want that to happen. We want to get out in front of it. Let's not have them get exposed, have them get injured in the first place. And that's what we modeled our team after. It is not how other jurisdictions do it. There are more and more jurisdictions that are coming over to our side and adopting this proactive versus reactive approach, but it's not done universally across California or across the country. But we do receive a lot of calls about how we structure things and help guide other jurisdictions if they're thinking of changing their models. So real quick, the basics of our team, it consists of about 4 to 5 members when we're fully staffed. It can consist of our senior environmental health inspectors, which is our 6122 positions, also our principal and standard inspectors in that series as well. We also have industrial hygienists that may consist on the team, and then senior industrial hygienists like myself that could be members of the emergency response team. As Director Fosdahl was saying, we run at all hours of the day. We're 24 hours a day, 7 days a week, 365 days a year. It's, Christmas Eve, New Year's Eve, Christmas Day, Thanksgiving, we have someone on duty and available to respond. When we're fully staffed, it means we are on call and on duty about 1 week out of each month, and we rotate it amongst the other responders. Want to touch on the training because we do a ton of training. It's definitely one of those things you don't want your skills to lax, so you have to do a ton of training. We're obviously not seeing incidents happen on a daily basis, which is a good thing, but less and less we see them, the more and more training we have to do. So right when we welcome someone onto the emergency response team, we send them away for 6 weeks. They do some off-site training to become a certified hazardous materials technician. That's the first 4 weeks of the training, and then 2 weeks to become a hazardous materials specialist. That initial 6 weeks of training is simply just scratching the surface. When they come back to us, we do anywhere from 4 to it could be up to 4 months or longer of in-house training. Part of it is dependent on what incidents we see in that time period, because we do want some on-job experience with another responder before we turn them loose on their own. So that's why it could range from anywhere up to 4 months or longer. We do some incident command system specific training. I know a lot of DPH employees are required to do some of the basic ICS training. We do all of it, and we do some specialized training with radiological materials, weapons of mass destruction, terrorist type events. We get all sorts of training on that, and then ongoing training also to keep our skills up, kind of the continuing education type of training. In-house, we also we've actually kind of structured it as a game. As we're passing over our emergency response duty to the next person, we give them an unknown, either solid or liquid material. And throughout that week that they're on duty, they have to use all of the equipment and supplies on our emergency response vehicle to identify what that unknown material is. And by the end of their week, report back to the team. So it's a way of keeping up our skills, and also a way to kind of try to stump each other. I've been stumped before. There's one responder, our chemist, Umberto Quinones, I've yet to stump yet. I'm going to get him eventually, but gosh, he's really good. So I hope to get him soon. I'll keep you posted. Identification of unknowns is very, very complicated. Just to show you, that is a portion of our sheet that we follow when we're looking at doing wet chemistry to try to identify a material. That's half of one side of a sheet. So that's just for liquids. We have a whole nother process to follow when we do solids. So it can get very, very complicated, but we're pretty good at it. So our structure, it's definitely different. It takes a little bit to get used to because we are DPH employees. We're employed by DPH, but we actually operate under the fire department command structure. So looking at that structure on the right there, we either operate as the safety officer, assistant safety officer, or technical reference, or any combination of the three during an incident. It is the one time that I would be able to tell Director Fosdahl that I can't do something that he asked because we got an emergency response call and I have to respond to the fire department. So this takes priority over all of our regular kind of more standard DPH duties. It also takes precedent over any life events, if you will. So there's been calls in the middle of, you sit down with the family to dinner and then you gotta run out after that. Grocery shopping just a couple weeks ago, I was at the farmer's market, got a call and had to put down my head of cauliflower and go address the call. But I did make it back for the end of the farmer's market, so I don't want you to worry about that. All right, some of our just kind of general duties and responsibilities. We provide on-site expertise and recommendations for personal protective equipment for our first responders. Again, that's getting back to we want them to be safe. Our one overall principle and our motto is that we do not bring victims to the scene of an incident. What that means is we want our firefighters, we want our police officers, we want any of our other emergency responders to go home in the same condition that they came to an incident in. So they should go home to their families in the exact same condition, maybe a little bit tired, but in the same condition. So we use incident specific information, and it depends on what the hazardous material is that we're addressing, or the multiple ones, to determine if, for example, the standard fire department turnout gear is appropriate based on flammability, or if a chemical protective suit would be more appropriate. We do a bunch of monitoring and interpretation. Monitoring is just half of it. We have a bunch of equipment that we can use to judge concentrations of different substances, but it's also being able to interpret that data to make a better, more reliable response. Like I said, identification of unknowns, we're very good at. We practice weekly, so not only do we have our wet chemistry, but we have a number of different pieces of equipment that we could use for that. We give guidance on establishing zones for spills or any other incidents that come up. Basically, where would the entry team be able to go in the hot zone, where our support staff would go, where we would want it delineated that members of the public should no longer be allowed. Is there a staging area for media if that is something that needs to happen? We would also be responsible for disposal and transport of any hazardous materials that need to be properly disposed of from a scene. Looking at decontamination protocols, that gets back to our first responders not wanting them to be exposed and wanting them to leave in the same condition. So after an entry team would go and make a incident safe, we want to be able to decontaminate their gear, equipment, everything, so that they do not get exposed afterwards. There's many other different responsibilities. We're expected to be the technical experts for everything hazmat related. So that includes emerging hazards, research on things that are maybe new to the field, and we coordinate with a lot of our other jurisdictions in technical advisory groups to do that. I always tell people our team is the ultimate example for collaboration. We collaborate with nearly every agency you could think of. So looking at our locals, obviously the fire department, the police department, public works, Department of Building Inspection, PUC, Department of Emergency Management, the port, Rec and Park. I think I pretty much named every local agency we have because that's who we collaborate with. We also collaborate with state agencies, so that could be California Department of Public Health, Cal EPA, State Fire Marshal, the Office of Emergency Services, State Water Board, and looking at federal agencies, we also work pretty closely with the FBI, the EPA, the U.S. Postal Service, which I'll explain those incidents as well, Drug Enforcement Agency, Department of Homeland Security, and the Department of Energy for any radiological type incidents as well. A lot of really great agencies that we collaborate with. I always like to take this point and just say there's a lot of power in those kind of logos up there. but I still think the bomb squads always take the cake because they just have the coolest logos I have ever seen. So those are a couple examples of those. We collaborate closely with them, but I'm always impressed at their kind of visual designs of their different logos. So we have the San Francisco Police Department and Sonoma County Bomb Squad as well there. So just some common incidents that we do see quite a few calls about abandoned hazardous waste. That is a number of 55-gallon drums that were dumped overnight in the parking lot of a school and childcare. So obviously not a good thing. We don't want those things in those locations. So the good thing with that is we were able to identify a responsible party and recoup costs and issue penalties for those that are dumping illegal hazardous materials in that manner. We do see releases or spills. This was I believe it was a mattress delivery truck from out of county. They tried to take one of our iconic hills in the direction that their GPS was taking them, and they probably should have gone around. It punctured the diesel tanks, and they ended up releasing diesel fuel for about 200 feet. So we were called in to help clean that up and stop the leak of those. We also see, this one was about a month ago, we do see some releases happen with old refrigerant systems in residential buildings. So this particular incident was a contractor was doing some standard construction, renovation, demolition in the basement. They severed a old refrigerant line that ran through the building that was behind the wall and still had refrigerant gas in there, quite a bit of it as well. It ended up we had to evacuate the building and seal up everything and then monitor to make sure it was safe for reentry. So we still do see that quite a bit. Suspicious packages and letters, we do see those types of incidents as well. This is a picture of one that was sent in San Francisco, and the person did not feel comfortable opening that and contacted the authorities. We worked with the San Francisco Bomb Squad to determine that it wasn't any explosive type threat. But there was, after x-raying it, we did see some what looked like powdered material in there. So we coordinated with our DPH lab to open it under a fume hood. It was a birthday card with some incoherent language in the card with a white powder material that we were able to determine was non-hazardous. So, but you never know. We always have to assume the worst until we can prove otherwise. This was another package that was delivered to someone in San Francisco through the U.S. Postal Service. Didn't look like it was in good shape. They also didn't feel comfortable opening it. It was left at their door, and it contained a number of different powders, liquids, some labeled, some not labeled. And it looked like it was some drug manufacturing type of lab grade glassware. So we were able to kind of adjudicate that, identify all of the materials that were in there and properly dispose of it as well. And then we do see, as Patrick was mentioning earlier, that we do see the standard white powder in letters that are sent to law offices, the police department. I remember there was a sergeant that got one around the same time every year, which was rather odd. It always ended up being non-hazardous, but there was clearly someone that was trying to scare that sergeant a little bit. Some uncommon incidents and events. We know San Francisco is famous for our special events. We have quite a few of them. Beta Breakers, Fleet Week. We just had one of the biggest ones that we had in my time on the emergency response team was for Super Bowl 50. I don't know if you recall, but they turned all of downtown into what they called Super Bowl City for 9 days before the actual Super Bowl. We worked in joint hazard assessment teams with the FBI, police department, fire department. We were looking for, the big terrorist type event. So we were looking for a radiological dispersion device, or a dirty bomb as it's commonly called. So in that picture, you'll see the backpack on there. That is a radiological instrument that detects any radiological material. It may not sound too difficult. We do get hits typically from those going through medical procedures. So if someone is going through chemotherapy, they will emit radiological material. It will be able to be detected by our equipment. So we have to stop and question them with law enforcement just to make sure it is not a threat. And again, that might not sound hard, but it's literally needle in a haystack. So that picture is from I believe it was the Friday before Super Bowl, when they had a large concert out there. There were about 100,000 extra people. That's on the Embarcadero, taken from above, on top of a fire department vehicle. So we're going through crowds and listening to our detection equipment and adjudicating all of those. We also see clandestine drug labs, somewhat infrequently, but enough to have to practice it quite a bit. Traditionally, that was methamphetamine manufacturing, but we also somewhat recently have seen fentanyl as well. So kind of a success story here. We started seeing pill press operations with fentanyl about 5 or 6 years ago. It was before you heard about fentanyl on the news. Now, I think we're all aware of what that is, and those stories have become too common, unfortunately. Well, we early on identified this as a potential threat, as we were seeing some cases there. We typically respond with the DEA and the police department and fire department. When we saw these type of pill press manufacturing operations, we thought about the early days when methamphetamine manufacturing was common. They had a law in California. It was called the Methamphetamine Contaminated Property Cleanup Act, where we would have to ensure that the property was properly cleaned up and before we would allow people back into there, because manufacturing of methamphetamine can get into the walls, and the last thing we would do is want someone to be harmed after we let them in. We saw a similar thing with fentanyl, so we worked with California Poison Control, some toxicologists at UCSF, to develop a cleanup standard for fentanyl. We started, again, 5 or 6 years ago, putting this into place as just kind of a local policy level. It is now actually is legislative. It is in the state law. So our early efforts on this not only helped get it into the California state law, but a number of other jurisdictions and states have called us for help in helping them get a similar standard legislated in their jurisdiction. So it can be, like I said, the contaminants can get deep into the building structure and materials. So that is a picture of one that was pretty contaminated. The only option, there was no decontamination that could be done. We went through a couple of rounds of trying to do that, but the levels were still high. So we actually had to strip the entire unit to make it safe for reentry, unfortunately. So let's look at numbers of incidents and some trends. So that's the last 7 years or so. From 2015, we did see a peak in 2018, and then the numbers coming down after that. So some of the trends that went into the numbers where they currently stand at, obviously COVID-19 put a stop to a lot of things in the city, and with less activity overall, there were less hazardous materials incidents, so less construction, less industrial activity, less manufacturing, all of that. COVID-19 has that effect on everything, and this was certainly also had an effect with us here. We also had a partnership with the San Francisco AIDS Foundation, their syringe pickup crew. Previously, we were sending our hazardous materials team to collect abandoned needles on the street. It is something that is a serious issue and needs to get cleaned up, but we determined that it didn't need a full response from a hazardous materials team. So we partnered with the AIDS Foundation and their syringe pickup crew. We coordinate with them to have them respond, which actually increased our response rate. Most of the time, any reports of abandoned needles that come in are taken care of within a couple of hours, which is great response time. Also, our DPH Municipal Hazardous Waste Program, they have been able to respond in place of our hazardous materials team for some smaller abandoned hazardous waste that is not an emergency situation. So that is contained, not going anywhere, doesn't raise to the level of an emergency. They respond to take care of those things rather than our full-on hazardous materials team. So that also was partly responsible for the decrease. Looking at the 2022 numbers, and it's obviously not over yet, so I want to knock on wood and hopefully we don't get a large amount of calls in the next few months. But the initial numbers look like they're right on par to be with those kind of 2015 numbers. And that's kind of where I think our standard response numbers are. So it looks like we'll be right about on par with that for the calendar year of 2022, barring anything unforeseen. There's a number of challenges. With our environmental health emergency response team. Vacancies and hiring. The environmental health branch has a number of vacancies currently, and that's in the 6120, 22, and 24. Those are our inspector level series, and in our industrial hygienist series. Those are the pool of employees that we select from to be eligible and participate on the team. I think we currently have 15 vacancies, and it's just difficult. The hiring process right now, it's difficult to get vacancies filled in less than a year, and sometimes much longer than that. We're struggling with that now. Like I told you earlier, our emergency response team, when fully staffed, should be 4 to 5 people. We are currently down to 2 people on the team, which is very difficult to maintain 24/7, 365 coverage, but we are doing it. We just recently went from 3 to 2, but we're managing to still get it done. So we're hoping that we can help push those vacancies forward to get other people trained up. Part of that is also the training. It does, once we actually hire people and select someone to do it, it's a long training process to get them on the team and able to respond just by themselves on duty. Also, part of it is, again, this is an add-on to the job. So not everyone is going to be interested in it. And that's, part of the challenge too. So while we have this pool that we can choose from, the pool gets even smaller when it comes to who would be interested and who would be eligible for it. There's also some limitations on distance from the city. Obviously, we have to be able to respond anywhere in 30 minutes or less. So living outside of the city is a little prohibitive of being able to operate on the team. As far as funding goes, we are a relatively unfunded program. We have a small budget just for consumable materials and supplies. So think like test tubes, your pipettes and stuff like that, and some chemicals that we use to determine unknowns. As far as equipment goes, we obviously want to have the latest and greatest available for our first responders. And for that, we rely solely on grants. Our Department of Homeland Security grants and the Bay Area Urban Areas Security Initiative, which I will call UASI because that's a mouthful. They've been very, very good to us over the last many years. We've had over $400,000 in funding for new equipment for our responders and training over the last 5 years. But it is a constant process of applying for grants and trying to stay up to date with our equipment, so we have the best available equipment to respond. We also do take advantage of some other smaller grant opportunities. The State Homeland Security Program is another one that we use, and then we do rely on some of our partners, the Department of Emergency Management, and in-house within DPH, our Public Health Emergency Preparedness and Response Group that always gives us heads up on any grant opportunities that come across their desk, which we sincerely appreciate. There are some other challenges. Once we get the grants, the challenges don't end there. A lot of the times what we're seeking is very, very unique equipment that may only be available from one manufacturer in the United States. There are a number of requirements and purchasing requirements that the city has and OCA has that we have to meet, and sometimes it makes it challenging to get one piece of equipment from one specific manufacturer. There's a lot of waivers that have to be obtained, and it definitely elongates the process. And when we get these grants, we have a very short window of time to use them. It's never more than a year. So sometimes in purchasing a big piece of equipment and having to get all of the approvals to have a manufacturer provide that piece of equipment to us, it's quite challenging sometimes. And that's just kind of part of the purchasing process challenges that have to go into, whether it's a sole source waiver or if we're prohibited from doing business with companies in certain states unless you can show a number of different things and get approval for that. It just makes large challenges after getting the grant, and we got to make sure our timelines stay in there because we certainly don't want to lose any grant money once we have it awarded. So definitely causes some challenges, but I don't like talking about challenges without also talking about successes and acknowledgement. So one group that I do have to commend is our hazardous materials and waste program. So this is within Environmental Health Branch. It's on the regulatory side. These folks regulate any businesses that store, use hazardous materials, generate hazardous waste, and they are absolutely great at their jobs. They make sure all those businesses do it safely, properly when thinking about segregation of chemicals, proper use, proper storage. They make our lives a lot easier as all of their work on the front end results in us having fewer incidents to respond to. So I can't give them enough credit for all of the work that they do, and I know they are also shorthanded as well. So yeah, kudos to them. Our internal and external partners, our FEPR group definitely helps us out a ton with planning and all sorts, wherever we need to turn to them. I feel like they're always there to support us. And our external partners, whether it's the Department of Emergency Management, our federal partners, we have a great relationship with a lot of those, and I've had to call many of them at all hours of the night, and they still answer my calls. So I appreciate that quite a bit. And biggest thank you goes to our environmental health emergency responders. That's a group of us there. That actually, so first that picture was a large scale exercise that we participated in on Alcatraz. It was the last tour of the day. There was a terrorist type event that happened there regarding a chemical warfare agent. So there were unique challenges to that of getting our equipment on the fireboat and across over there. And this might sound like the premise of a bad or maybe good movie. I'm thinking there was no Nicolas Cage sighting there on Alcatraz for this one, but we were able to kind of adjudicate everything, and it definitely left a unique exercise that we did. So I can't thank the emergency responders enough. Just for example, on that incident, we were there till about 1 or 2 in the morning. You can probably see how cold we are in that picture, but I cannot thank them enough for their ability, skills, and just ability to adapt to any given situation. So I'll let you in on a little secret. We're called the Environmental Health Emergency Response Team, but I also call us the superhero team. They're kind of superheroes. They really are. So I can't thank them enough. You'll see the clear resemblance not only in skills but also in good looks and physique to a lot of the superheroes, I like to say. So, or at least that's what I keep telling myself. So, yeah. Thank you. Any questions that I can help address? And yeah, I just want to thank again for giving us the opportunity to present here today.
All right, before we go to commissioner questions, let's check in with the public. Folks on the line, if you'd like to make comment on item 3, the environmental health emergency response team presentation, which you just heard, please press *3 now. Okay. I see one hand. Everyone gets 3 minutes. Just a reminder that questions that may be asked are not, there's not a back and forth between presenters and the public, so it's a one-way conversation. Folks online just know that. And let's see, person on the line, please let us know that you're there.
Hi.
Yes, please begin. You've got 3 minutes.
Hi, I'm a UCSF pharmacy student, and I was wondering how is SF making hazardous medical waste disposal sites available to unhoused individuals, and how does the environmental health emergency response team play a role in this disposal?
All right, thanks for your comment. Mr. Piakas, if you're able to respond to any of those easily, that'd be great. If not, then we can note that for the record.
Yeah, so our emergency response team is able to respond to any, hazardous materials types incidents that would involve, unhoused populations as well. We also work with, like I said, the AIDS Foundation for, needle disposal and needle pickup. We also closely collaborate with all of our other DPH partners that support the unhoused populations with regards to any medical waste or anything like that. So, yeah. Good question, and yeah, definitely something that we're involved in whenever we need to be involved. So,
thank you, commissioners. Let's see, Commissioner Dorado.
Thank you. Yes, this was a great presentation. I'm really glad that you came in front of us. I only really know of the hazmat from the white uniform. My question, and I'm sorry for this. Could you describe in maybe this year some of your incidents?
yes, we've had a handful this year. Some large, some not so large. We definitely have had some kind of abandoned hazardous waste. We just recently had some abandoned hazardous waste that was near the proximity of a park, and it was, like these things, they don't typically happen, 8 to 5 on our schedule when we would like them. So it was about an hour till school was, about to let out. And so we raced over there to get everything cleaned up and just barely had it done by the time the school was letting out and the park was starting to get populated. So definitely a success story. And that was just last week. So that one's fresh on my mind. We've had a couple clandestine drug labs over the last year. One that involved methamphetamine production and one that involved methamphetamine and fentanyl production. We just recently closed the last one out of that and being able to be cleaned up and reoccupied for the public. So those are a couple that stand out in my mind. We did the abandoned hazardous waste is definitely one. We did have that one about the refrigeration system and gas. We were very fortunate that we only had to evacuate the building for about 3 or 4 hours, which typically it can be a lot longer than that sometimes. But we were able to resolve that one very quickly. And the residents that were evacuated were very cooperative and definitely thanked us for our service, and I appreciated that too, because I always feel bad when you have to displace someone, even if it's for 3 or 4 hours, when not expecting it. So yeah, those are some of the ones that we've responded to over the last year.
Thank you. My other question is the challenge in your hiring. I mean, you're down to 2. which means, you're on call 24/7 every other week. You mentioned some of the issues, living the 50-mile radius. But is also the training, the extense training, or I don't know if people are coming out of, junior college, bachelor's being trained as, maybe, it's concerning, for a pipeline. So maybe you could comment on that because, I hear you and understand what you're saying.
Yes, it is. It is. We're doing 2 week shifts now, so 2 weeks on, 2 weeks off, which is a little more manageable than every other week because then the weeks kind of meld together and you feel like you're always on call. So, but we're managing it as best we can. Yeah, I think we're making some progress with our human resources to try to get those positions filled, and then that will help get a greater pool of folks to select from. I think that's the big thing, is getting our vacancies filled. But we're making some progress, especially recently. So I'm optimistic in that. We also have noticed that just in the field of hazardous materials, whether it's on the regulatory side or emergency response side, there's been less interest in that. So over the last about 5 years, we've been really trying to do everything we can to generate interest at a young age, and that includes having our student interns in here. We do a lot of educational events. We just did one at the Giants Stadium not too long ago, where it was like a science day, and this was, we had our equipment out there and tried to generate interest in that, and it was very, very, very successful. So we do want to generate interest at a young age, just as you said, to keep that pipeline of folks that are qualified and interested coming through.
Thank you very much. And good luck going forward.
Thank
with
you.
your
Appreciate that.
Commissioner Chung has her hand up too. Commissioner, your audio isn't coming in. No, I can see you. Maybe can you turn off your camera and to see if the audio works better when you're talking? Because we can see you, but you're, try that. No, we're not able to hear you, unfortunately. I'm sorry. If you want to call me on my cell phone, I can put your voice up to the speaker so he can hear you, and maybe you can figure that out during the next presentation. You want to try that? Sorry, everybody. Give me a second. Hi, I'm going to put you on speaker and then put the speaker to the speaker, and you can talk from there. Okay? Okay, go ahead.
Yeah, thank you for the. I have to take this out. I can hear myself echoing. Well, thank you for the presentations, and it's really enlightening. And I'm curious on a couple of different things here. One is, like you mentioned, the first incidents that you were mentioning, like when this was conceptualized, it was during a time before the internet and all we had was the landline. So in terms of like technology, like how much has that changed, like the way that the department work? That's the first question.
Oh, yes, it has absolutely changed 100%. And I feel like it's changed another 100% in the last 10 years or so. So I think all of our kind of wet chemistry with how we identify unknowns, which was clearly all we had in the 80s during this incident. That's always our fallback. It still works today. But especially with technology, as far as all of our equipment goes, that continues to evolve with, even advanced equipment with Bluetooth technology and being able to see live readings from the entry team that gets, transmitted back to the emergency response vehicle and the incident commander. Video, everything. It has changed quite a bit, definitely from the 80s, but I feel like every 5 years there seems to be even more, which is great, which is part of why we have to continue to get grants and equipment and all of that to get the latest and greatest technology to keep not only the public safe, but the emergency responders safe and all of that. So yeah, it has changed quite a bit, but when technology and equipment goes bad, goes wrong, which it happens, it really does, and it seems to happen at the worst times, we still have our fallback of our wet chemistry and our radios that we still carry on the trucks. So yeah, it has changed, but we still have the things that are old faithfuls to fall back on as well.
And I also want to say that judging by what you mentioned, like the size of your team, you definitely are superheroes because of, the vast in the range of incidents that you are responding to. And, and also, like the risk of some of them, especially, when you talk about like drug lab, for instance, or some radioactive materials. And And do you actually, the department do the cleanup, or do you actually have contractors coming in to do the disposals and the cleanup?
Yeah, that's a good question. I appreciate the kind words. We do have contractors. We have contracts with contractors that we could use if we need to. Depends on the size of the incident. We try to take care of as much as we can in-house without using the contractors, but there are times where things are just too big for our team to handle, and we would call in the help of a contractor as well to help us out. Also, what plays in part of that is as far as timing goes, if it's something we could take care of, but it's going to take longer to do that. Like my example with the incident with the by the park recently that happened last week, time was of the essence there. We were able to handle that in-house, but if it took longer to do that, where it might threaten a specific population, we may call in a contractor to help us out to make sure it gets taken care of more expeditiously, essentially.
Well, thank you for all the work you do there.
Oh, so the commissioner said thank you for all the good work. All right, thank you very much, Commissioner. And by the way, your audio came in randomly while you were talking on the phone, and then it just went off again. So I don't know what's happening. All right, so let's move on. The next item is the Public Health Accreditation Progress Update. And just, I just want to note that item took a little longer than what we were anticipating. It's 2:55 and the meeting has to end at 3:45 so that I physically can go in the other room and set up for the full commission. So please keep that in mind. Give me 3 seconds or 30 seconds to pull up my screen. And Priscilla, you're able, please come and introduce yourself.
So, hello, can you hear me?
Yeah.
Okay, so for some reason I don't see myself on the video and I don't know what is going on there because my video worked earlier today, so I apologize for that. So good afternoon, commissioners. My name is Priscilla Chu, and I am the manager of Public Health Reaccreditation, and I've come today to report on the progress of Public Health Reaccreditation and where we're at in the process. Next slide, please. So I'll give you an introduction to accreditation, provide a framework for how we are getting the work done, tell you about the actual progress that we've made, and then some recap with our next steps. And we do have time, hopefully some time for questions at the end. And my presentation, I don't think will be as long as Jonathan's, although he is now my new superhero also. Okay, so public health accreditation is the measurement of health department performance against a set of nationally recognized practice-focused and evidence-based standards. It is the issuance of recognition of achievement of accreditation within a specified timeframe by a nationally recognized entity. And the goal of accreditation is to improve and protect the health of the public by advancing equity, quality, and performance of public health departments. And looking at the benefits of accreditation, which I often get asked what they are, I really think that achieving public health accreditation makes us a better health department, which in turn improves the health of San Franciscans. So I like to say that we become more of a bionic health department in that we are better with continuous improvement. We are stronger in our partnerships with both community and also other city agencies and across the city. And we are faster, meaning we are more responsive and adaptable to change, such as during an emergency response. So, all of these things are part of the benefits of accreditation. Next slide, please. There are numerous plans and reports that are required for public health accreditation. These are all topics that PhD, as the public health arm of DPH, really excels. So, the community health assessment, it demonstrates that we have the capability to conduct a thorough health assessment with analysis and interpretation of results. The CHIP is the Community Health Improvement Plan that flows out of the CHA, the Community Health Assessment, and then helps to prioritize the needs of the community and focuses on a few areas. The strategic plan takes the health of San Francisco into account and also aligns with the priorities in the CHIP. The Workforce Development Plan works to address areas that need implementation for the strategic plan where we may not have the capability yet. The Workforce Development Plan is not found at the DPH level or at the city DHR level. So right now, only PhD has a Workforce Development Plan, which I am really happy that we have one to develop our workforce. The Emergency Operations Plan is an all hazards plan for different public health emergencies where PhD takes the lead. So, COVID was one of them, for instance. MPOX is another. Heat emergencies is also one of the ones where we are providing a key role. Okay, next slide, please. In earlier this year, in the first quarter, the Public Health Accreditation Board published their new and revised standards and measures for version 2022. And this is the version that we are using for accreditation. Instead of 12 domains they had previously, there are now 10 domains. And just note that equity is really at the center of the work. And there's been a lot of language that's been strengthened around equity. So for domain 1, it's about assessing and monitoring population health status. The very first measure in domain 1 is the community health assessment. So it's that one little box, that's one measure, but it did take a year and a half to complete that and to get that done. For domain 2, we have investigate, diagnose, and address health problems and hazards affecting the population. So this has to do with our emergency response. Our emergency response plans live in this domain. Domain 3 is about communicating effectively to inform and educate people about health, factors that influence it, and how to improve it. Domain 4 is about strengthening and mobilizing communities and partnerships to improve health. Previously, Domain 4 was very top down about how do health departments provide technical assistance. So they've now changed the language to be how can we better partner with community? And I really appreciate the new language. Domain 5 talks about creating and championing and implementing policies, plans, and laws that impact health. And following that is domain 6 is utilizing legal and regulatory actions designed to improve and protect the public's health. So a lot of the environmental health work lives in domain 6. For domain 7, it's about contributing to an effective system that enables equitable access to the individual and care needed to be healthy. So before it was just about access to health care, and now I think the language has been broadened to be access to other programs and other things that can increase health. Domain 8 is about building and supporting a diverse and skilled public health workforce. So previously in the other version, it talked about having a competent workforce, but I appreciate that they put the word diverse in there and skilled for public health workforce. Domain 8 was one that I really like thinking about because it talks about having um, a workforce that is also in a supportive work environment, that they are being developed to do the work, and the importance of recognition of staff. Domain 9 is about improving and innovating public health functions through ongoing evaluation, research, and continuous quality improvement. Domain 10, this is where the Health Commission comes in. It's building and maintaining a strong organizational infrastructure for public health. So it includes governance in here, as well as IT roles and finance roles. Okay, next slide, please. So given that the new standards just came out earlier this year, we held a meeting in May 2022 to tell everybody about these new standards. We're getting ready for accreditation. And then I showed this graph, and if you sort of squint at it, you can see there's a lot of red here, which means that it's not started yet. And that's because at that time, a lot of these measures were still new to us. The yellow boxes mean that it has started, and green means that they are ready for review. So while we did have a lot of red boxes, we weren't starting completely from zero. But you can see some people were dismayed when they saw this initial graph, and I'll talk more. I'll follow up on that later. The next slide, please. For domain, so for each domain, and I'm just using domain 1 as an example domain, we describe what the domain is about. And just a note that each domain is divided into standards, and each standard contains one or more measures, and each measure may have one or more required documents. So that will help you understand future slides. So next slide, please. We did track the different accomplishments that were completed within each domain, and that's because we had different teams working on them. So we needed to keep track of all the different interviews that were done, and what just what was done for each domain and for each measure. And if you look at the next slide, you'll see that we have every measure ready for review. So for domain 1, there are 3 standards, so 1.1, 1.2, 1.3. For standard 1.1, you can see that there are 2 measures. That's 1.1.1 and 1.1.2, and it's denoted by that third number at the end. And then the light green boxes below each measure show the required documents needed to fulfill the measure. So for instance, measure 1.1.2, which is the second green box from the left, has 2 required documents needed to fulfill that measure. Next slide. At the end of where we are now with domain 1, for instance, you'll see that we started with it being maybe 16% done, and we are now 100% ready for review. That means that we've been able to write up all the measures and turn them into documentation. And then we have a review process ready to go for the next phase, which I'll also cover in a little bit. Next slide, please. So we have made a lot of progress. If you squint at this slide, you'll see that there's more green and yellow and a few red boxes. We've made a lot of progress from May until now. All of those red boxes have been assigned to a team to work on, with the goal to turn them into green by the end of the year. So note that domain 6, even though it has no green boxes, 3 of the 4 are in process and are farther along, and that 6.1.1 has been started. So when you look at the next slide, so you'll see that domain 6 looks like a 0 because we haven't been able to make any of those green at the time that I published this to the Health Commission. But that there is progress being made on that. So I just wanted to reassure you of that. Every measure that was red is at least a yellow as of today. Next slide. So overall, we are about halfway of getting our measures to a complete status and ready for review. And we are still aiming to have them all completed by the end of the calendar year. We are also starting the process of reviewing the completed measures to date, and then we are on track to have them to have them ready and also to start that review process for January. So we started that January process a little early, and I'll show you in a couple of slides. So in the next slide, you'll see that we achieved accreditation in 2017, and we need to be reaccredited every 5 years. Last year, we received a 1-year extension, so our new deadline is for March 2023, which is coming up fairly soon, but it is coming along. And the bottom line is that we are on track to apply for reaccreditation in March 2023. Next slide. So we have some next steps. So every measure that is not in that complete green yet has been assigned to a team to work on and to move forward. And we are, again, on track to have the measures ready for review by the end of December. But we also started that January review process that we are going to start in 2023. We are starting it this month for the ones that are already completed and completed in the sense that they are green and ready for review. But the idea is that by the end of the year, we'll have all the information. January, we will review and look for gaps. In February, we wanted to have some outside review to have like somebody with fresh eyes to look at the information. And then have corrections made and ready for upload by the time we hit the button at the end of March 2023. The next slide. So I wanted to give a shout out to I have used extensively and creatively, I think, student interns for a lot of this work, and they have been a tremendous asset to the division and the department. And they're my extra arms and legs as I send them out to go and get the information from various sources. and they have brought a lot of energy and passion to the work. And they have used the time to learn about the breadth of public health work. They've also used the time to interview, to do the informational interviews with the different people that they meet with, as well as collect information on the specific measure that they're asking about. So I consider it a really big win-win for everybody involved. And I just, yeah, appreciate them so much. We also have a lot of internal subject matter experts who have made themselves available to us, and that has been a great help too, because they hold the information that we may not be able to find somewhere, and so it sort of lives in their head, or it's in a place that we are not sure where to find. I'll address some of the commissioner questions at this time. So the first question is that there are 22 interns listed on the slide. What is the time span of their internships over the project period? Are the internal subject experts in the Department of Population Health, or are they focused on accreditation only? So interns come from local universities, and they're with us for 1 semester. So the hard part is that they do need to be retrained as we get a new batch of students coming in each semester. I've had 2 semesters so far, so I've had 7 interns. Well, 9 interns over the summer working in 2 teams. And then this fall, I had 15 interns working across 4 teams. And that's and then I had these 2 super interns who as I point out, Yeneth and Anne, who really helped to organize some of the work with the sub teams, and really provided feedback, were the first to really understand a lot of the work so that they could explain it to their teams. Our internal subject matter experts are from across PhD mostly, but some also come from DPH at a broader level as well. And because reaccreditation covers all the essential services of public health, subject matter experts are called upon, and they're interviewed across many different areas of public health work. Question number 2, for Domain 4, there were other partnerships other than Mega Black SF reached out to for community engagement, and if so, what organizations? So a little bit about our work and our process is that we are looking for strong examples that meet the criteria for the measures in Domain 4. Veronica Shepard was one of the people that we interviewed, but it's not listed in the accomplishments, but there were other groups that are actually listed for our accreditation documentation. And those include the Latinx Task Force, the African American Faith-Based Coalition, and the Food Security Task Force. So that's for Domain 4. Question 3, is the majority of the domain activities focused on interviews and review of policy documents, such as in Domain 8, Found Code of Conduct on SFDPH website, Policy and Procedure Library? It seems that interviews were the primary data collection. So I think data collection for us came in many different forms, including interviews as well as reviews of policies and documents, things that we could find online. We created standard work to look for and create documentation. And while we do many interviews, the first thing that they had to do was to really do background research to see what's already been done in that measure, either in the previous semester or has already been found, and then do research as well on the DPH website to see what information we can find. And then after doing that background work, if they still need information, we then work with them to formulate questions to ask during the interview. and that way, as a team, we are being mindful of people's time and making the best use of their time with us, and making sure that they are well prepared before they go into any meetings. Oh, by the way, their interview with Mark was one of their favorite meetings. They really enjoyed the time with him. So thank you, Mark.
They were a lovely group.
Yeah, thank you. And I'm also appreciative of our PhD and DPH staff, who made themselves available for these meetings. And some of them were also informational interviews, so they kind of shared about their career path as well. And so I think the students have really enjoyed the time with meeting our various staff. Um, yeah, so that's all that I have. And I have a thank you slide.
I stopped sharing, Priscilla, because I thought you were
Oh,
ready.
that's okay. Yeah, that's pretty much it.
Thank you.
And then I had some reference slides for domains 2 through 10 for your reference.
Thank you. And Priscilla, before we go to questions, do you have a piece of paper over your camera? Because it looks like it's kind of moving around. Is there something covering the camera?
Is? No, there isn't. I
Okay.
just used the camera for another meeting today, which is very
Okay.
puzzling why it's not turning on now.
But no worries. I'll go to the
You
public.
know what? Maybe it's with my laptop. Let me see if.
There we go. Now we can,
Oh, okay.
yeah, there we go. Okay.
Great.
Lovely to see you. Okay, I'm going to go to
Yes.
the public comment. Folks on the line, if you'd like to make comment on item 4, the public health accreditation progress update, which you just heard, please press *3 to raise your hand. I see one hand. Again, remember, you've got 3 minutes and that you're able to ask questions, but there's not a back and forth between you all and presenters or the commission. That helps us maintain order. All right, person, you are unmuted. Please let us know that you're there.
Yeah, Priscilla, thank you for a great presentation. My name is Sylvia. I'm also a UCSF pharmacy student. And I know in this presentation you mentioned that access to care and how that there's constantly quality improvement projects ongoing. I was wondering if there's anything going on with the sexual health portion of the sf.gov website. I wonder if there's any improvement on the amount of reproductive health information there is, because I feel like currently the website is mainly geared towards pregnancy and it has an outside link for a source on birth control or abortion. But maybe if there could be a healthcare team that worked together to provide information directly onto the website, it could be more user friendly. I don't know if that's something that your team might cover.
Yeah, so that is not an area that I am directly involved in, but I can certainly pass on your concern to the team.
Great, thank you so much.
Thanks for your comment. Commissioners, any questions or comments? Oh, Commissioner Gerardo, please feel free.
I just want to thank you for answering my questions that I submitted. I really appreciate it. Thank you.
Sure, of course.
Okay. Thank you so much, Priscilla, for all your work in the presentation today. And commissioners, we can move on to item 5, emerging issues. Anything? Folks on the line, would you like to make public comment on emerging issues? Press *3. I don't see any. So we can go to item 6, which is public comment. And folks on the line, this is a time to make comment about something that was not on the agenda. Each agenda item has public comment, so you make comments about that item at that time. This would be for an item or topics that are not on the agenda today. Press *3 if you'd like to make comment. All right, I see no hands. So commissioners, you're now in consideration for adjournment.
Motion
so
to adjourn.
I heard you both. And with 2 of you in the room, that completes the action. Thank you so much. Commissioner Chung, I hope you get your audio fixed. Commissioner Gerardo, I hope you feel better. And thank you all who attended today.
I switched laptops, so
Great.
I'll figure that out later, the other one later.